Have you ever felt a subtle pressure in your chest and brushed it off as nothing serious? Perhaps blaming it on something you ate or just a bit of everyday stress? Many adults over 65 do exactly that. It can be surprisingly easy to dismiss mild, fleeting discomfort, especially when it doesn't stop you from going about your day. After all, many of us have navigated aches and pains for decades. But when it comes to your heart, ignoring even mild chest tightness can be risky. As we age, our bodies send us signals that sometimes require more attention than we might think. You've spent a lifetime learning how to cope, to push through, to keep on going. Yet the stakes for overlooking certain warning signs become higher with every birthday we celebrate. It's not just about preventing a hospital stay, it's about preserving the quality of life you cherish. Imagine staying energetic enough to keep up with your grandchildren on a brisk walk through the park, or feeling confident to travel cross-country to visit old friends. Heart health after 65 is critical for maintaining independence and enjoying all of those precious moments that make life so rewarding. By proactively addressing mild chest tightness, you can strengthen your heart, sustain your energy, and reduce the anxiety that can come with wondering if you're truly doing everything you can to stay well. Today, we'll explore 5 key points to help you understand why it's so important not to brush off mild chest discomfort and what you can do instead. First, we'll tackle the dangerous misconception that if it's not severe, it's not worth worrying about. Next, we'll talk about the role subtle symptoms can play in signaling underlying heart issues and why seniors in particular should pay attention. Then we'll move into empowering steps, from practical lifestyle adjustments to stress management techniques. We'll also look at how to work with your healthcare providers more effectively so you always feel in control of your heart health. Finally, we'll talk about building a supportive environment, whether it's your living space or the people around you, to ensure you have the help you need when it matters. I've seen firsthand how these steps can make a difference for older adults striving to remain independent and vibrant. While I'm not here to give you one-size-fits-all medical advice, I am here to share guidance drawn from a wide range of trusted sources and to remind you that you are not alone. Your body, and especially your heart, has a story to tell, and tuning in now can help write a much happier, healthier chapter as the years go on. Before we dive into the details, let me ask, have you ever felt that subtle twinge or pressure and thought, it's probably nothing? If so, you're not alone. But by the end of this video, you'll have a new perspective on what it might mean and a game plan to protect your heart. So settle in and let's talk about how even mild chest tightness can be your best early warning sign for heart safety and what you can do starting today to feel more secure and empowered about your health. Let's get started. It might seem obvious that chest pain deserves medical attention, but many seniors still avoid checking on little episodes of tightness. Let's look closely at why this happens and what you can do instead to safeguard your heart. Some people think it's probably acid reflux. Others might chalk it up to just getting older. But the truth is, mild chest tightness can sometimes be an early red flag. So let's break down 5 essential points to clear up misconceptions, build awareness, and give you practical tools for everyday heart care. First, we'll address the pervasive idea that only dramatic symptoms matter. Then we'll explore the subtle ways your body might be signaling trouble and how to interpret those signals. After that, we'll discuss small lifestyle changes like moderate daily activity and mindful eating that can help you stay on top of heart health without feeling overwhelmed. We'll also talk about forming a strong partnership with your healthcare team, which includes knowing what questions to ask and how to speak up about what you feel. And finally, we'll touch on how to make sure your everyday environment supports your efforts, whether that's rethinking your daily routine or getting a little help from friends and family. With these 5 steps, you'll be better equipped to handle chest tightness the moment it appears and continue living with confidence and peace of mind. Let's dive in. Point 1 begins now. Even if you've been healthy all your life, it's easy to assume that mild chest tightness is no big deal. Let's uncover why that assumption is risky and how being proactive can make all the difference. Point 1. Many seniors believe that only severe crushing chest pain is cause for alarm. You might think, if I'm not doubled over, it can't be serious. In reality, mild discomfort, especially in older adults, can signal a range of underlying issues. Take Linda, age 72, who noticed a light pressure on her chest whenever she went up the stairs. She chalked it up to being out of shape and mostly ignored it. A few months later, that same tightness didn't just appear on the stairs. It showed up when she was simply walking in her garden. Concerned, Linda finally visited a specialist. It turned out she was experiencing early signs of angina, a condition that can lead to more severe problems if left unchecked. Because she delayed seeking help, she lost valuable time to manage the issue early on. This example reveals a common misconception, that chest discomfort has to be dramatic to be real. Maybe you too have felt a momentary tightness after doing something as simple as carrying groceries. Or perhaps it appears and disappears so quickly, you tell yourself it can't be important. However, medical professionals note that seniors often present with more subtle symptoms for serious cardiac conditions. As we age, our bodies change, and the typical alarm bells might sound softer. That's why the new perspective to adopt is that no chest symptom, however small, should be completely brushed aside. So what are some practical ways to stay on top of this? First, consider keeping a simple log of when and where you feel chest discomfort. Write down whether you were climbing stairs, cooking dinner, or simply watching television. Note the time of day and how long the sensation lasted. This record offers a clear picture for any healthcare provider, making it easier to identify patterns or triggers. Second, if you notice that the tightness has a specific cause, like walking up a slight hill, pay attention to whether that threshold is getting lower. Are you getting the same feeling now from just walking down the driveway to fetch the mail? These signs can help you track changes in your endurance and heart function over time. You might wonder, but won't I be pestering my doctor with every little complaint? While it's good to be mindful about scheduling appointments, staying alert to heart-related changes is not a nuisance. Healthcare providers appreciate when seniors arrive informed with a concise log of symptoms. It allows them to make better decisions on your behalf. Plus, by addressing minor symptoms early, you may prevent major complications later. This proactive attitude can have tangible physical and emotional benefits. Physically, you're more likely to catch developing problems before they escalate. Emotionally, you'll have peace of mind knowing that you're not leaving your heart health to chance. If you're still feeling hesitant, consider that listening to these little warning signs is akin to checking the oil in your car before taking a cross-country trip. It's a small step that ensures you're not ignoring something that could lead to a breakdown later. Being vigilant about mild chest tightness gives you the power to live more fully without the fear of a looming health crisis that seems to come out of nowhere. Now that we've addressed the misconception that only severe symptoms matter, let's move on to point 2, where we'll explore how subtle changes in your body can signal deeper cardiac issues and what you can do to interpret those signals with greater confidence. Point 2. Another belief older adults often hold is that getting winded or feeling a bit off is just part of aging. It's true that our stamina changes over time, but not every breathless moment or chest flutter should be written off as normal. Consider Harold, age 68, who found himself feeling slightly breathless and experiencing a twinge in his chest when bending over to pick up the newspaper. He waved it away, telling himself, "I'm no spring chicken." However, after several weeks, those twinges started to appear during his morning walk, something Harold had done every day for years without issue. Rather than ignoring it further, Harold decided to pay closer attention and realized the discomfort was following a pattern. It appeared mostly after he'd been inactive for a while and then stood up too quickly. Armed with this observation, Harold consulted a doctor who discovered a potential circulation issue. Addressing it early allowed Harold to manage the condition through a combination of mild medication and consistent light exercise, preventing any significant decline in his overall heart health. Harold's story highlights how subtle bodily signals can speak volumes about underlying cardiac conditions. Rather than accepting every new sensation as just aging, it's more helpful to evaluate whether a pattern is emerging. Does the discomfort happen mainly in the morning or after a meal? Do you notice it more when you're stressed or anxious? These clues can be priceless when it comes to early intervention. That shift in mindset, from ignoring mild signs to actively looking for patterns, can make a significant difference in outcomes. If you're someone who's not sure how to differentiate random, harmless annoyances from genuine concerns, here's a practical strategy. When you notice a discomfort, assign it a 1 to 10 scale, with 1 being extremely mild and 10 being excruciating. Do this consistently for at least a week. You might find that your 2 out of 10 chest tightness remains at a low level. Or you might notice it creeping up to a 4 or 5 on certain days. This simple self-monitoring technique gives you something concrete to discuss with your healthcare team. It's not about jumping to conclusions. It's about gathering information. On top of that, pay attention to other symptoms that might accompany the chest tightness, even if they feel minor. Are you getting lightheaded, nauseous, or sweating more than usual? Are you noticing palpitations or an unusual fatigue that sets in more quickly than before? None of these feelings alone might scream emergency, but together they could point to something that needs medical attention. When you begin to tune in to these small changes, you gain more control over your health decisions. Physically, early detection can mean simpler, less invasive treatments. Emotionally, it replaces guesswork and worry with clarity. You'll also find it reassuring to realize you have the power to manage your health in a more engaged way, rather than waiting for things to get worse. What if some of your concerns turn out to be a false alarm? Even then, being cautious about your heart is never wasted effort. You'll gain insights into how your body responds to exercise, stress, and everyday activities. That knowledge is empowering and can guide you toward better self-care habits overall. Take a moment right now and think. Have you noticed anything about your daily routines or physical responses that's changed over the past few months? If so, jot it down. This small action might be your first step toward a meaningful conversation with your healthcare provider, or even just a trusted friend who can help you keep track. Let's keep the momentum going. Now that we've explored how subtle bodily cues can be an important window into your cardiac health, we'll transition to point 3 and delve into specific lifestyle habits. We'll look at how moderate activity and mindful diet changes can counteract those warning signs, and in many cases, even help reverse them. Before we do, I'd love to hear your thoughts so far. If you're comfortable sharing, have you ever overlooked a mild discomfort that turned out to be more serious than you initially thought? Point 3. A common misconception among older adults is that significant lifestyle changes must be dramatic, like signing up for a triathlon or overhauling your entire diet. That idea can be intimidating enough to discourage anyone from even trying. But the truth is, small, consistent steps can have a surprisingly large impact on managing mild chest tightness and supporting heart function. Consider Paula, who is 75. She was experiencing light but recurring pressure in her chest, mostly in the evening. She was worried any exertion would make it worse, but she decided to test a modest approach. Each morning, she did 10 minutes of gentle stretching, followed by a slow, steady walk around her block. Gradually, she added a few more minutes each week. Over 2 months, Paula's endurance improved, and she noticed that the evening tightness showed up less frequently. Another perk was that Paula felt more confident overall, like she was actively participating in her own health rather than passively waiting for problems to develop. This illustrates that you don't have to become a marathon runner to make meaningful changes. Start small and be consistent. If you're currently not doing any dedicated physical activity, even adding a 10-minute walk can help condition your cardiovascular system. Look for activities you enjoy, maybe gentle yoga in your living room, water aerobics at a local pool, or light gardening. If you have mobility concerns, focus on chair exercises or even simple seated stretches that keep the blood flowing. The goal is not to push through pain, but to remain active enough to support your heart, muscles, and joints. In addition to movement, consider the foods you choose. You might think of strict diets as too rigid or restrictive, and you're not alone. But small dietary adjustments can align perfectly with your heart's needs. For instance, if mild chest tightness arises after heavy meals, try shifting to smaller, more frequent meals. Incorporate heart-friendly foods like oats, berries, leafy greens, and nuts in moderation. If you're on a tight budget, focus on affordable staples, beans, lentils, and seasonal vegetables. The key is to aim for balance and moderation, not perfection. The physical benefits of these steps are fairly direct. Better circulation, a strengthened cardiovascular system, and potentially lower blood pressure. But there's also a profound emotional benefit to gradual lifestyle improvements. Each walk or nutritious meal is a small victory that boosts your confidence. Instead of feeling at the mercy of unexplained chest discomfort, you feel like you're taking charge in a tangible way. This sense of agency can combat the anxiety that often accompanies health concerns in our senior years. You might wonder, what if I overdo it? That's a valid concern. Start by checking in with a healthcare professional, especially if you have a chronic condition or mobility limitation. They can give you tailored guidelines. Then, pay attention to your body's responses. If you feel pain or become extremely short of breath, ease up and rest. There's a fine balance between challenging your body enough to improve heart health and listening carefully when your body says, that's too much right now. As you integrate light exercises or tweak your meals, keep track of how your chest feels before, during, and after these activities. You might discover that a certain kind of exercise, like brisk walking, actually reduces the frequency of your chest tightness over time. Or you may find that swapping out a heavy dinner for a lighter one in the early evening eases the burden on your digestive system and lowers nighttime discomfort. Lifestyle changes can feel daunting, but they don't have to be. Start with one manageable step, celebrate that, and then add another. Over weeks and months, these small victories add up, helping you steer clear of severe complications and maintain a better overall quality of life. Up next is point 4, where we'll discuss how to work more effectively with your healthcare providers. After all, your journey to better heart health doesn't have to be a solo endeavor. Professionals are there to help, but learning how to communicate and collaborate effectively can make all the difference. Before we continue, I'm curious, which aspect of lifestyle change seems most approachable to you right now? Exercise, nutrition, or something else? Thinking about where you might start can help make it a reality. Point 4. Many seniors operate under the assumption that doctors are too busy for trivial symptoms, or they hesitate to mention mild chest tightness because they fear being labeled a hypochondriac. But effective collaboration with healthcare professionals is one of the most powerful tools you have. Imagine Frank, age 74, who spent months avoiding any detailed conversation with his doctor about brief but recurrent chest twinges. He worried his physician would dismiss it or add more pills to his regimen. Finally, after an especially restless night, Frank wrote down everything he'd been experiencing: frequency, duration, what he was doing when the tightness hit, and any other details he recalled. At his next appointment, he said, "I'd like your help understanding these symptoms." To Frank's relief, his doctor took the information seriously, ran some preliminary tests, and caught an early-stage heart condition that was more manageable when addressed sooner rather than later. The key lesson: your doctor can't read your mind. A clear, well-documented description of your experiences helps them help you. If you're worried about being brushed off, remember that most healthcare providers appreciate patients who are actively engaged in their care. You can start the conversation by saying something like, "I've noticed this tightness about 3 times a week after dinner. Should I be concerned?" Approach it as a collaborative effort rather than a one-sided request for answers. Ask open-ended questions such as, "What could be causing this, and what can we do about it?" Or, "Are there any lifestyle adjustments you'd recommend before we consider medication?" However, it's also important to recognize that doctors vary in their communication styles. If you feel rushed during appointments or you're not getting the clarity you need, consider asking for a referral to a cardiologist, a second opinion, or even a dedicated nurse practitioner who can spend more time addressing your concerns. Some clinics offer educational sessions specifically aimed at seniors who want to manage heart-related issues proactively. Seek out these resources if they're available. Additionally, many seniors find it helpful to bring a friend, adult child, or caregiver along for support. This person can take notes, ask questions you might forget, and provide emotional backing. 2 sets of ears are often better than 1, especially if the conversation gets technical. You might feel more confident speaking up if someone is there to remind you of the questions you intended to ask. Remember, a supportive healthcare team is more than just doctors. Pharmacists can be incredibly helpful in identifying whether certain medications might contribute to chest tightness. If you're prescribed new drugs, make sure to ask about potential side effects and interactions, especially if you're already taking multiple prescriptions. Physical therapists can offer specialized exercises that target cardiovascular health in a way that fits your mobility level. Nutritionists can help craft meal plans that are heart-friendly yet still enjoyable. The goal is to assemble a group of professionals who understand your unique situation and respect your input. The benefits of collaborating with professionals are both physical and emotional. Physically, you increase your chances of catching and managing conditions early, thereby reducing the risk of hospitalization or invasive procedures. Emotionally, you gain peace of mind and a sense of agency. Instead of feeling alone in deciphering random pains or off days, you have a team in your corner who can provide direction and reassurance. Let's not forget, no single medical professional sees your daily life as closely as you do. By sharing your observations, you become the expert on your own experience, adding vital information that tests and numbers alone cannot capture. In the next point 5, we'll dive into how to shape your environment, both physical and social, to support your heart health. Because even the best advice can fall flat if your surroundings or daily routines make it hard to follow through. Let's continue, but if you have a moment, think about the last time you visited a healthcare professional. Did you feel heard, or were there questions you wished you had asked? Reflecting on that could help you prepare better for your next appointment. Point 5. A final common assumption is that your environment, your daily routines, your home setup, and the people in your life doesn't really affect something like mild chest tightness. Yet small changes in your surroundings can make an enormous difference in managing heart health. Think of Martha, age 76, who lived alone in a 2-story house. Martha frequently had to go up and down the stairs for basic tasks like doing laundry or grabbing her glasses from her bedroom. She'd often experience a soft, squeezing sensation in her chest partway up. Instead of ignoring it or considering a move to a single-level home, Martha found practical ways to minimize the strain. She organized her space so that the items she used most were on the ground floor. She placed a comfortable chair at the midpoint of the stairs, giving herself a spot to rest if she felt any tightening. Over time, she noticed that this arrangement cut down on the occasions when the tightness flared up. Martha also reached out to her neighbor's teenage son for help with carrying groceries. This small social arrangement became a two-way street. He earned a little extra money, and Martha felt less isolated knowing someone checked in on her regularly. Plus, she wasn't risking unnecessary physical strain. This example shows how adjusting your environment, both your physical space and the social dynamics around you, can reduce triggers that might aggravate mild chest discomfort. You might consider whether your home setup is as heart-friendly as it could be. Simple modifications like installing grab bars, rearranging shelves to avoid heavy lifting, or using a wheeled cart to move items around can reduce strain. If stairs are your concern, look into whether a stair lift or main floor bedroom is feasible. These aren't just conveniences. They can help you avoid sudden spikes in exertion that your heart may not appreciate. Your social environment also plays a big role. Isolation can increase stress, which is often linked to heart health issues. Connecting with friends, neighbors, or family can be more than just emotional support. It can also be practical support. Maybe a friend can join you for short walks, turning exercise into a social event you look forward to. Or perhaps you can share healthy meal ideas with a neighbor who's also trying to watch their diet. If in-person connections are limited, explore online communities or senior-focused groups where members exchange tips on staying active and healthy. Having a support system, whether physical or virtual, eases the emotional burden of dealing with health concerns on your own. Emotionally, feeling supported can translate into lower stress levels and a more positive outlook, which is beneficial for heart health in and of itself. By making small but strategic changes to your living space and social network, you create an environment that sets you up for success. It reduces the chances of triggering chest discomfort through needless physical strain and encourages you to remain gently active throughout the day. Emotionally, you feel less anxiety knowing you have people and systems in place. Over time, this environment-first approach becomes part of your life routine, effortlessly supporting your heart rather than working against it. You've now explored all 5 points. recognizing that even mild chest tightness can indicate serious issues, paying attention to subtle patterns, incorporating gradual but meaningful lifestyle changes, partnering effectively with healthcare professionals, and creating a supportive environment. Each step helps protect your heart and sustain your independence. Let's bring everything together in our concluding thoughts, focusing on how you can move forward with confidence and peace of mind. But before we wrap up, take a moment to visualize one realistic change you could make at home. Whether it's reorganizing your kitchen so you don't have to reach overhead too often, or asking a neighbor to help with your yard. Sometimes picturing a single concrete step makes it easier to follow through. It's time to conclude our discussion, but don't go anywhere just yet. Let's make sure we leave you with a sense of direction and an empowering call to action. It's clear that ignoring mild chest tightness can carry significant risk for older adults. But the good news is you have more influence over your heart health than you may realize. Let's briefly recap the key ideas we've covered. First, we challenge the belief that only severe, dramatic chest pain matters. Even the smallest twinge can signal something important if you're over 65. Next, we learned how subtle bodily cues, like feeling winded during everyday tasks, might point to underlying cardiac issues. Then we saw how moderate, consistent lifestyle changes, from short daily walks to minor shifts in meal habits, can make a real difference. We also discussed the importance of working with healthcare providers openly and honestly, bringing them clear information so they can help you effectively. Finally, we examined how structuring your environment, from your living space to your social circles, can reduce physical strain and emotional stress. These steps all add up to a proactive, holistic approach that can help you catch potential problems early, manage existing conditions more effectively, and maintain a higher quality of life. There's genuine urgency in taking action now. The older we get, the more crucial it becomes to pay close attention to warning signs and adjust our routines to support heart function. Yet this urgency doesn't have to feel overwhelming. Small, steady changes can lead to significant improvements over time. Can you see yourself implementing these ideas? Picture your day. Instead of quickly dismissing that light chest pressure, you acknowledge it, note any patterns, and maybe pause to do some gentle breathing. Perhaps you find yourself motivated to reach out to a neighbor for a shared morning walk, or finally ask your doctor that lingering question about occasional tightness. Visualizing these moments can help you realize they're well within your reach, and the results might be more freedom and less worry in your daily life. If you're ready to take the next step, here are a few ways to move forward. First, consider talking to someone you trust, whether that's a friend, family member, or healthcare professional, about what you've learned here. Share your thoughts, your concerns, and the possibilities you see. Next, decide on a small, tangible change you'll implement this week, like adding a quick walk to your morning routine or reorganizing a frequently used cupboard to reduce strain. If you're feeling more ambitious, schedule a checkup to discuss any subtle symptoms you've been experiencing. And if you're the type of person who likes to learn in a group setting, look for local senior exercise classes or community health workshops. Each action you take is a step toward protecting your heart and living life on your terms. As we wrap up, remember this. Your heart has carried you through many decades of life experiences. It's worth every ounce of care you can give. By paying attention to mild chest tightness instead of ignoring it, you're giving yourself the best possible chance at continued vitality and independence. You're not defined by a single health concern or a certain number of birthdays behind you. You're defined by the choices you make right now. I invite you to embrace those choices with confidence. If you found this information helpful, consider sharing it with a friend or family member who might also benefit. Every conversation we spark about proactive heart care strengthens our community of seniors who support each other in living well. Thank you for taking the time to learn about this vital topic. Your heart and the rich life it allows you to lead deserves nothing less.